Thank you.
So moving on, now we've got Auckland Regional Public Health Services next. Well, welcome. Thank you. William and Hayley, so I understand no presentation, just your good selves.
No presentation, just we'll be speaking to you today. So I've met many of you before, so thank you for having us back again. I'm Hayley Pritchard and I'm accompanied by Dr. William Ranger, who's our Medical Officer of Health for Smoke Free. He'll be leading our discussion today.
Tēnā koutou katoa. Thank you for the opportunity to speak to you today. We just have a brief verbal presentation and would like to leave more time for discussion and questions. Overall, we support the intent of the Māori and Pacific Action Plan as a targeted approach to address inequities in our Māori and Pacific populations, as that it will enable positive community cohesion, engagement, empowerment, and can improve participatory democracy. So we do support the plan. However, we think that the plan can be further strengthened in a couple of ways, which I will outline, and some of the things have already been discussed by the previous presenters. Firstly, and as just discussed by the Cancer Society, the implementation plan should be fully integrated within the wider Council's smoke-free 2017 to 2025 implementation plan, and that budgeting should be allowed for this. We don't have a specific recommendation in terms of proportions, but it's very important that the targeted Māori and Pacific plan links effectively with the wider strategies that are reflected in the wider plan that have been talked about by the Cancer Society, so that they're mutually reinforcing. We do believe that both those approaches need to be linked together and that the budget needs to be there to support those activities. Our second general issue in terms of improvements is that the Māori and Pacific plan could be further enhanced in terms of its detailed design and detailed implementation by further attention to the evidence base. And we've talked about some of the evidence around vaping, which I won't repeat, but the plan can be supported in its implementation by further attention to the evidence base. And AFS, Auckland Regional Public Health Service, the team that's here today, has considerable expertise in terms of the design, implementation and monitoring public health programs, and we're very keen to support the further detailed work that will take place for implementation, and we seek Council's mandate to be engaged with your staff on that work. As I say, I'm going to leave more time for discussion, but just to talk about two key issues from an evidence-based perspective. One is the issue of the evidence for vaping, and there's been extensive discussion about that already, so I'm not going to repeat that. However, our view is that vaping is a tool for cessation. It needs to be linked very clearly to other cessation tools, but it is not without harm, and the full evidence for its effectiveness as a quick tool and its potential for harm is still emerging, and therefore a precautionary approach is to be taken. However, it is a tool, and it's how you promote it that's the key there. The second and final issue is around the approach to community development, which is very much at the heart of the Māori and Pacific Action Plan. We support the intent of that approach, but we add a word of caution about the infrastructure and the resourcing to make those approaches effective. There's a lot of evidence about what works in terms of community activation and community development and what doesn't work, particularly in the smoke-free domain, and we're very happy to work with the team to support that. But in a nutshell, it's very important to ensure that the capacity and capability within the community is well supported to deliver for success. That would be my word on that. So that's a brief submission from Auckland Public Health Service. We're very happy to engage with you in any questions and discussion. Thank you.
Awesome, thank you. Questions, Councillor Darby.
Thank you, Chair, and thanks for your presentation. Just in terms of what is the name of the body, and has this body agency in New Zealand sanctioned vaping as a smoking cessation tool? I note that in the US, the Food and Drug Administration is yet to sanction vaping as a smoking cessation tool. Has that been done in New Zealand, and by whom?
Not to my knowledge, but Hayley, can you answer?
It's not my area of expertise, but the government is in the process of being able to provide further guidance on that. At the moment, it doesn't fall within MedSafe. I'm sure Haupai will be able to, they know the details about that more. So it's not, I'll leave it to them.
So
I'll leave it to them.
I think a further word on that is that it relates to what Dr. Jones was talking about, that e-cigarettes and vaping are a consumer product. They're not regulated, and they're certainly not regulated as a medicine. So other quit tools like nicotine patches and so forth can be used as therapeutic products and have been through a process for that regulation, which is via MedSafe. Now that hasn't occurred for these products. So essentially they're unregulated.
Okay. Thank you for answering that one. And is it correct that you can order double-strength nicotine capsules or inserts for vaping, and therefore how far does that go to putting an individual at risk of cardiovascular disease, higher blood pressure, etc., which nicotine particularly contributes to?
Yeah.
I guess in terms of our Auckland Regional Public Health approach to today is that we're here about a policy that was designed for a tobacco policy. We're really passionate about reducing the impact of tobacco in terms of vaping. I don't want to get into an extensive debate about it. We've heard from an expert before, and Haupai will be commenting significantly on that as well. So I'll leave it for them to comment on. And just really want to emphasise that the smoke-free policy from Council was developed to address harm from tobacco, and I really want to just keep pushing that back onto the agenda today so that we don't just get into a vaping discussion. Vaping is one tool to prevent the harms of tobacco, but it's not the only one, and that's why we're here talking about a wider smoke-free policy too. Thank you.
Thank you. I think that's a really important issue for us to hold in our minds as we deal with the substantive issue after lunch. Any other questions? Councillor Bartley.
Thank you, Madam Chair, and through you. Thank you for your presentation. Do you think that that Council can, the Cancer Society is asking that Council run a public awareness campaign and focuses on its public places, its facilities. Do you think that can be done together with the community-led approach, or instead of, or just focus on Council first as providing a leadership example, and then community can tie in underneath that?
Yeah, so I think that it's a role for both to play. So Council does have the mandate to do this. It's in their policy. It's great. It would be really great to see the policy implemented really strongly so that it can support the community to go through and do the interventions. I mentioned with the policy team a few weeks ago, for example, if you have a sports club that's not strongly implementing their lease requirement that they are going to be smoke-free, it adds additional challenges for then the community to come through and enforce that within those grounds. So I think you need both of them done properly. I think the community also brings their own approach to which is more relevant than what Council can do in terms of communicating to their people. So you definitely need both strands to that.
And I think the answer to your question is yes, they can and should be linked together for maximum effectiveness.
And Hayley for the presentation. Is there a seconder for that? Councillor Bartley. I'll put that. All those in favour, please say aye. Against? Carried. Thank you very much.
Thank you.